How you doing, everyone? Dr. Dex Alvarez here, Palmacia Chiropractic Wellness Center. And today I had a really good question from a patient. And I think it was a great question for a lot of people to ask. And I think hopefully it'll help out with a lot of people to know a little bit about this information. And the question was from a patient asking me if chiropractic care would be beneficial or helpful for her mother that was just diagnosed with lumbar spine stenosis. And so she really wasn't quite sure what that term even meant. And what her mom's treatment options were moving forward. So it's a term that we hear quite a bit in our field, and patients are getting more and more educated on it. So I wanted to make sure everybody kind of knew A, what it was, and B, how we would be able to help it. So what stenosis means is basically a closure of a space. So when you get that diagnosis of a spinal stenosis, it's a very broad term. So we have to understand what is taking up the space, where it is, and then how can we fix it. So when you're talking about stenosis, it's usually from two different areas. Either a central canal stenosis, which is the central part of your spinal column where your spinal cord runs through, or a lateral canal stenosis, which is on the sides of the vertebrae where the nerves exit to go out to your organs, your cells, your tissues, your arms, your legs, and it's how your brain is able to communicate with the different parts of your body. So if you have a closure of any one of those spaces, it can diminish the amount of information traveling over that nerve or across your spinal cord, slowing down that message or creating pain because now something's pushing up against the nerve all day, every day. So can it be helped? Absolutely. Actually, research shows that chiropractic care is the most effective way of treating lumbar stenosis without the use of surgery. So if you're one, kind of like me that wants to stay off the surgical table as much as possible, chiropractic care is a great way of handling these closures of these spaces. So there's a lot of different ways we can work, from decompression to flexion distraction to an adjustment, to where we can start to safely and easily open up these spaces in a gentle way. That way we can alleviate the pressure not only on the spinal cord or on those exiting nerves to A, get rid of the discomfort that you're feeling, but B, also to make sure that that message from your brain over your spinal cord across that nerve is getting where it needs to be at 100%. So if you know of anyone, family members, yourself, that has heard that term or been diagnosed with some type of spinal stenosis, just know that it's not a lifelong diagnosis. It's something that can be taken care of very gently, very sustainably with alternative care such as chiropractic. And that way we can also keep you off the surgical table. Make sure you're leading the life pain-free that you're really looking to lead. So if you have any questions, please reach out. If you need to make an appointment here in the office, we have we have spots available here moving into the summer months. So let us know. We want to make sure you're having a great summer and enjoying the time with your family. So I hope you have a great rest of the day. Talk to you soon.